Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. We're here at the CHIME Fall Forum, and our guest is Tom Liddell. He's CEO at Harmony Healthcare IT. Welcome, Tom.
Thanks, John.
Yeah, excited to dive into today's topic. Really the challenges of archiving, data conversion. Harmony's done a lot of work in this, but before we go there, tell us a little bit about yourself and Harmony Healthcare IT.
Sure, John. Thanks again. Thanks for having me. This fall forum's always kind of a special time of the year where we get to interface with leaders. The leaders get to listen to their latest and some of the biggest challenges facing them, and some of their learn about some of their successes. Yeah. So it's really very exciting for us.
Yeah.
So I just welcome it. I welcome the interaction.
Absolutely. I think I heard this a decade ago from Neil Vercel. He said Chime is the place with the highest concentration of CIOs, healthcare CIOs, and that's true.
Absolutely. Russ continues to build just a great team, and we're just happy to be part of the equation.
Awesome.
Yeah.
So tell me about some of your background in Harmony Healthcare IT and the work you do with these healthcare organizations.
Yes. So I'm a veteran in the health technology space. Proud to say that I started that career in the 80s, and it's largely been in the automation of health information and data for that. So a couple of different companies that I've had the fortune to be able to be at the leadership spot for those. And our latest iteration, 16, 18 years in the making, is Harmony Healthcare IT. So, myself and others are kind of known as people that sort of get it done, and that's what we've continued to do in this sort of a quieter organization. But when people talk about us, the good things come out of that, and we're very proud of the work that our team provides. As we think about it, what we're known for is an enterprise data management solution. And so I broadened that word. Initially, I think it came in the form where people would say, oh, those are the guys that archive data, that decommission systems. And we've watched that expansion happen kind of smartly over the last 5 years to a broader data set. I like to say, sort of moving up market, we like to think about data managed for life, and kind of that double entendre of we help the lives of others, and that's core to our belief in our company. And then in addition to that the life cycle of data is such an important it is the most important thing that a healthcare IT leader faces in terms of systems and that management.
Yeah, it's interesting because you're right. Data hits compliance, it hits cost, it hits care. Be able to manage that effectively is so important. But what do you see as some of the big challenges that healthcare organizations face today? I mean, we're surrounded by CIOs. What are you hearing?
Well, there's such a myriad of topics that one can have, but through the lens of the work that we do, the most practical things I'm going to say are the increasing velocity of data, and what to do with it. What to do with it in terms of cost, in terms of secondary use, value. All of a sudden, from outer space about 3 years ago starts to arrive this thing called AI. That's now talking to data or thinking about data in ways that that have brought us some other leveraged computing that allow us to think in some different ways for that. But practically speaking, we are still seeing 2 or 3 major things. The cost for me to maintain, the management of that maintenance, where all the data is, right? Just simply stated. So we solved that one thing, which is if you have 150 systems, we're going to knock that down to one system architecture, value and managed, and we're going to flatten costs like you've never seen for that. And we do that consistently for that, and then give a management layer to that. So I would say it drives both both those practical things affecting the budgets, affecting the care that we have because we interoperate that data back into those system architectures, and ultimately this other hovering thing around cybersecurity. So now I don't have data scattered to the wind. I have it in a concentrated place that I can put the right kind of hardened shells and layers around that management approach.
Yeah, I mean, I think that's really interesting that, it's cost. That's an important one, that for every CIO today, and you have to do it in an effective way, but how do I do it across these disparate systems? I think that's really interesting. And where does Harmony Healthcare fit in with helping them do that? Like, what if they look at Harmony Healthcare IT, what problems can you help solve for them?
Sure. Well, there's one example might be, and we see this often, that there's a growth strategy, and somebody says, "Well, how would Harmony fit into that?"
Okay.
Well, we've now been able to deliver a partner program that they can plug in immediately and say, if my work is to bring together ambulatory surgical centers or physician clinics, that I can have a consistent playbook that says, here's exactly how we're going to come in, manage that conversion, that migration of that data. By the way, also then manage the decommissioning of that system, even through the contract and support process, all while when they come on board, the confidence of all that data is there. And it flips quickly into, hey, we can really trust these guys as a partner to deliver. So that's one example where you might say, well, I wouldn't have even thought of them as kind of a growth engine, for my organization.
Well, I think that's a fascinating one, because the biggest challenge of acquisitions is application consolidation, decommissioning old applications. That's why many of them are like, do we want to do this? Of course, the CEOs say, I don't care, we're acquiring them, figure it out.
Right? That's right. So we've gone from, having an organization call us and say, hey, we had no idea, to now they have a playbook that says, hey, consistently I can bring in and deliver of that. And we can do it in scale. So if somebody says, I'm bringing 30 of these in this year, we can say, let's go do it. Let's go do, one about every week in 2 days, and be on time and on scale and deliver for that. That's the other, I guess, connecting piece here is there's two other words that come to mind that we think are really important, and we've been validated. It's the ability to scale, which is you need to be able to call me and I need to be able to say to you, absolutely, we can start that project in 2 weeks. We're ready to do that. So we've really built some efficient methodologies and processes for planning, and are confident in that, and that continued scale. The second thing that happens in that is trust becomes this groundwork, this bedrock in those relationships, and it's built off of many things. Everything from, I got to trust that you're going to be here 10 years from now and even 20 years from now, and but still make it personal and make it a relationship that's in that. So we've been fortunate to be able to do that.
Yeah, it's interesting because budget, determines a lot of the decisions, and when the budget hits, you need to be able to spend it.
There's no doubt. Right. There's no doubt on that.
Having that
front.
Speed is so important. I'm kind of struck by a couple things that you've said, though, right? Which is, this kind of trinity of things, which is cutting costs, improving productivity, but then also, something that I kind of mentioned is enhancing security, right? We have this trinity of things. Talk about why that's so important for healthcare leaders, and how Harmony is looking to do those things effectively with your solution.
Yeah. It's a great question, I think, and fortunately, as you say, the kind of connection of all those three things, or that trinity, as you say, what I would say it gives best confidence to is a couple of things. One is that CIO, that health leader, that CTO, that Chief Medical Information Officer needs to be pointed to the next thing. And in that, if they know that confidently, hey, I've got Harmony over here, they're going to do that. And oh, by the way, they can deliver that to my next North Star. They can get me migrated. They can tell me that my patient population needs some tightening up here. They can identify a record. They can go the next mile in these EHRs where, we light up and say, hey, there's data and it's based on this condition and you're seeing somebody for a bad back. We've got it. So those little touches of technology blended to that confidence of security, because nothing more important than defending that. And, we're going on 9-10 years of high trust, 600-700 controls. We bring clients to that experience. We share with them things, and in many cases, they'll take us up on, hey, how would you do that? Or what else might you do, on the cyber side, which again, kind of links you right back to that trust that we want them to have, in us for forever, candidly.
I think it's interesting, as I think about the CIOs I've talked to and then, about archiving and legacy applications and all of those areas, I think some of them think, oh, that's just simple. You should just be able to do that. Talk to me about, what do people not understand about what it takes to do healthcare archiving, data management in the right way, right? I mean, I think, to be fair, you could do it in a really crappy way.
Yep.
Anyone could do that, right? But to do it right and to do it effectively, what are some of the nuances that people maybe don't understand?
Yeah, it's I'd say it starts with an organizational commitment, which starts at the top with leadership that says we think about those assets in ways that are assets, right? So the management of that asset, the de-risking of that asset, the governance management around it as well, that says there's a consistent protocol and methodology that does that frankly is tied to returns. So we look and go, every day that needs to be tied to returns so that we can look and say, we've earned our way in this particular one. We took that $1 million X EHR and we've knocked that thing down to 10% of that cost, and we've done it inside of a year, and it's a real tangible number for somebody that they're essentially writing that check back within that as an example for that. And so kind of the final piece that I would say there is, we don't need a lot of resources, but we do need to have that method in that says, hey, do we have legal to understand your contract opportunity for retrieving data?
Okay.
Do we have a methodology that says, hey, this vendor, because we're going to tell you, is going to make something difficult, in that. The beautiful thing is we're 640 different healthcare software applications that we've decommissioned.
Wow.
And so our knowledge book is significant, and we share that with that organization to say, here's where we can go. You want to do something a little different? We're glad to do that and flexible. And one last thing I want to add here is that probably uniquely for us, we are really flexible in our business approach.
Okay.
Many organizations are like, we just got to take you all the way to SaaS because that's going to be better for us. We're certainly happy to do that if that works out better economically, but we're happy to do a more standard way, or somebody says, hey, I want to do this a little more upfront and really flatten costs, at another level. I think that part of it is, it's a bit of the scale we've been able to do. All US, 200 plus people, this is what we do.
Yeah. I'm still processing that many applications. I mean, of course,
it's a lot.
It makes sense.
You'd be surprised.
When I think about the CIOs I've talked to, but
we probably manage another 400 where the data sets are just managed. So when you think of life cycle of data management, there's that which needs visualization, and there's that which is, hey, I did my audit in 2015. I have 4,000 spreadsheets.
Yeah.
I want to bundle that up. I want to store it. Well, it's even beyond cold storage. It's that middle space, because we've had cold storage forever.
Yep.
But where you're like, I have some management. I want to take a video of what that was, or it was dental records from 2005 back. But somebody's like, I want to keep those odontograms for that. We've had a recent one too where we're working in digital pathology and trying to marry digital data to physical data. That's a whole other area around research. Yeah.
Wow.
So it's data. It's data. It needs to be managed. It needs to be secured.
For sure.
Yeah.
What do you think does differentiate the various approaches and organizations, companies in the healthcare archiving and data management space? What are some of the ways that you differentiate yourself?
I would say completeness of work, our willingness to bring deep engineering prior to the commitment of the work has been probably our secret sauce. It gets challenged sometimes when somebody's like, just go do it. And we're like, shouldn't we take a look at this and understand that? So that commitment is expensive for us, but we feel it's really valuable because we can then go and say, hey, here's the dialogue that's driving that. I think the other thing is, we have a really experienced, talented team, and I'm going to just say an attitude that is, tell us how we can help. Our core values drive us, and that sounds, every organization that's good should have those things. We truly have that. I think people would tell you, like, we'll dig in and roll up our sleeves and get after the work, but to get after it in a way where it scores. The last thing I would tell you is, just as an example, this year, we think of quality as a scoreable event. We right now, as I sit here with you in October, have over 400 interviews that we've done internally with to just say, how better could we do this? And we apply that iterative process to that. We have another 3,000 just surveys that come in off of experience, and we randomize that, and then we score. We've been scoring, our NPR for forever, candidly, and we share that data out. We benchmark that data to ourselves and back to the organizations. So if you're willing to measure it, then you can't hide from it, and then you have to improve it.
Then you got to face it.
Yeah, that's right. That's right.
I love that. Maybe give us a preview. What's coming next for Harmony Healthcare? Are there any new products on the horizon? And talk about how that's going to help impact, the organizations you work with.
Absolutely. Well, just recently, a couple of things. The continued enhancement of our interoperability inside of electronic health records, right? So, as an example, we've been working with Epic, Meditech, and others, but, in those spaces where our product stays ahead of the rest of the market. So, Legacy Record Indicator would be a great example, just some months ago, an acknowledgement to the marketplace of that. As I think forward, we're focused in a couple of areas. How can we help reduce costs, which reduces stress, provides more economic opportunity? And so we've been analyzing and working through what I'm going to call just this whole area of registries and being able to, again, back to quality utilization of data, and specifically abstractors in that area where we can say, hey, we might really be able to impact that. So it's applying, candidly, our AI models that are not using it's applied to their data, not in their data. And we look out for some things in 25 that I think you're going to find interesting. Across our product, we've enhanced our accounts receivable wind down product and portfolio there. And then, as we talked about, if you have this archive that's viewable, there's this middle ground. We call it this kind of middle storage. We're bringing out that name and convention, but lots of people are bringing those on. Here'd be another example of that. Somebody says, I need to store my DNA study files, and I may not need to have it all indexed to bring up in a UI and viewer, but I want to be able to go unearth that, because those are, as an example, like 6 gig files.
Yeah,
well, we're building the middle layer that's the most affordable that you can do, that leverages without getting stuck to some of the public cloud vendors and being able to do that. So that gives you a little bit of preview. Some great stuff around QA and services as well that people can utilize in the migration space that we've actually helped others doing migration work. We just go apply our QA tool set to that.
That's awesome.
Yeah.
Well, I find it so interesting. I think anyone that doesn't have an archive is missing out, because as we discussed, it hits the most important things: a cost containment. You don't have to pay the previous
Certainly
licenses.
Does. Yeah.
Access to data, which you need to be able to provide quality care, and also compliance, which of course you have to retain for 6 months, 8 months to 12 years.
Or 21 years.
Depends on the state. And
we have one client out 30 years. So.
Oh, really? Well, and
so
pediatric ones are even more complicated.
That's right.
So,
and important. So important.
Yeah.
when you get into those, for sure.
So I appreciate you bringing a solution that does, span that whole, spectrum of things that every CIO leader needs, and educating us on the space. So I appreciate you taking time to talk with us. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcast applications. Thanks, Tom.
Thanks, John.